My dear friends, I am Dr. Colonel Brahmajit Singh from Hyderabad. I am a medical oncologist, that is, I am a cancer doctor and I treat all types of cancers with chemotherapy and the latest treatment modalities such as targeted therapy and immunotherapy. Do you want to prevent and protect yourself from cancer? Do you want to know what causes cancer? What are the risk factors, the warning symptoms, and how you can prevent and protect yourself and your family from cancer? And if you are a cancer patient, would you like to know what, when, why, and how of cancer treatment? If you are interested, press the bell icon, subscribe, and stay connected. My dear friend, it is very easy to get confused and to feel lost in this world of cancer. What is the correct way of treating cancer? What are the different modalities of treating cancer? What are the types of treatment of cancer? Why systemic therapy, local therapy, and supportive therapy is required? What is localized treatment of cancer? What are the types of localized treatment? What is systemic treatment of cancer? What are the types of systemic treatment? Why are there so many types of treatment? What is supportive treatment? If you have the answers to these basic questions, then not only will you be able to understand how and why of cancer treatment, but will also be able to assess if your treatment is the correct one. So before I tell you about the types of treatment and what is systemic and localized therapy, in order to understand the why and how of treatment, you have to first understand cancer. Visualize cancer as a tree. A tree has several parts. It has a root which is below the surface. We are unable to see and assess how deep the root is. Similarly, for cancer, it is that part of the disease which we are not able to assess, such as the extent of spread of cancer as metastasis and micrometastasis. Metastasis means spread of cancer which is visible on imaging such as a CT scan or an MRI or a PET. And then there are micrometastasis which presently no imaging modality is able to detect because they are taking place at a cellular level. The other prominent part of the tree is the trunk, something that is easily visible to us, and its dimensions give us an idea about the strength of the tree and also an idea about the depth of the root. If the trunk is huge, it implies that the root system would also be extensive. Similarly, in cancer, it is that part of the disease which is visible to us clinically or on imaging, and it gives us an idea about the stage of cancer, how extensively the cancer has spread as seen on imaging, that is a CT scan, MRI, or a PET scan. Then there are the branches and leaves. In terms of cancer, they depict the symptoms and signs of cancer. So, as a tree has roots, trunk, branches, and leaves, cancer also has metastasis, micrometastasis, visible tumor, and associated signs and symptoms. Now, if we have to remove the tree in totality and prevent it from coming and growing back again, we will have to uproot it. That is, remove it with its roots. Till the time the roots are still there, the remnants of the tree can sprout again. Similarly, when we treat cancer with an intention to cure or even palliative intent, we have to make an effort to destroy all the places as it has spread. The metastatic and the micrometastatic sites have to be addressed. Those cells which are present there have to be killed. And this, my dear friends, is only possible if we give systemic therapy. So you understood systemic therapy? That is that treatment that circulates in our blood and reaches all parts of the body where the cancer cells are hiding as metastatic tumors or as micrometastasis. Now, it is but obvious that for this to happen, we have to give medicines either by an injection directly into the vein, that is an intravenous, so that through the veins these medicines circulate throughout our body, killing the cancer cells, and the other way is in the form of a tablet or capsule which we swallow. These tablets or capsules melt inside our body in the intestine and are accordingly absorbed and released into the circulating blood in our veins. Presently, we have chemotherapy, hormonal therapy, targeted therapy and immunotherapy as the modalities of systemic therapy. We usually consider hormonal therapy as a type of targeted therapy. So basically there are three major types of systemic treatment, namely chemotherapy, targeted therapy and immunotherapy. And they do work of destroying the tree along with the roots, the trunk and the branches and the leaves. Now, if we want to cut the trunk of the tree or only cut branches which are causing any issue such as a symptom, such a treatment which only addresses the local disease, that is cut the trunk, cut the branches, and that kind of treatment which will have its effect only in a well-defined area. You can say kind of a focused at a specific site. Simply put, local treatment, localized, is called localized therapy. In the treatment of cancer, two most common and important modalities, that is the type of localized therapy, are surgery and radiation. By surgery, we try to remove as much as possible of the visible cancer from a well-defined part of the body. Obviously, we cannot treat the metastasis and micrometastasis by surgery in totality. The other modality is by radiation, also called radiotherapy, which uses targeted energy, which includes X-rays, photons, radioactive substances to destroy cancer cells, shrink tumors and or elevate certain cancer-related symptoms. And since it is not possible to give radiation to the entire body, radiation is used for the treatment of a specific site of the cancer. Then we have another very important component of therapy, and that is called supportive therapy, which also includes symptomatic therapy like pain management, that is like cutting the small twigs and leaves of the tree. Basically, symptomatic or supportive therapy has no effect on the survival of the patient, but is one of the most important modalities responsible for preserving the quality of life of the cancer patient. For every patient has the right to live and die with dignity. Treatment of different cancers, and in different cancers, the stage of the cancer and multiple other factors determine which treatment is the correct treatment for a specific patient. Sometimes systemic therapy in the form of chemotherapy is given first, then surgery and then radiation. And sometimes radiation and chemotherapy are given together before or after surgery, and similarly targeted therapy and immunotherapy. The field of cancer treatment, my dear friends, is rapidly evolving and numerous trials are going on all over the world to assess the best possible treatment which will have a significant impact not only on the quality but also the duration of life of the patients. You also need to understand that treatment of cancer is not done as per the whims and fancies of a doctor. There are specific guidelines which tell us why, when and what treatment is to be given. That is called evidence-based medicine. Now, the reason I am sharing this information with you is because I want you, yes, you to understand why, what and when of cancer treatment. And now your homework, if I may say so, would be to speak and discuss with your cancer doctor the same 3 W's of treatment: why, when and what. If your doctor is able to satisfy you by his or her answers to these questions, you can be rest assured that your treatment is going in the correct direction. In case there is something more that you want to know, use the comment section. I'll definitely answer it for you.